So, we're going to talk about what regenerative medicine actually is, and we're going to talk about what pretty much everybody else is practicing. So, what we have opted into over the last, since patent pharmaceuticals became more dominant, is degenerative medicine. And it's been in the guise, in the sheep's clothing of healthcare. What it is doing, it is completely shutting off the acknowledgement that there's an upstream problem. It's only focusing on the downstream effects. And what that's doing is changing people's association and changing people's beliefs in what health really is. So there's been this reorganization of all of our minds to essentially delegate out, rationalize, socialize, normalize disease. And what that's ultimately doing is so when we're coming at it from this position, it's a disempowered position. And so not only are you affecting someone on the mitochondrial level where you are not addressing what the real upstream problem is, and I would be hard pressed to find any problem that we're addressing in the clinic not being related to a mitochondrial issue, but also we're creating limitations within the mind that disempower the individual. So a person essentially undergoes a spiritual death before a physical one. And that's something that I've just kind of come to the conclusion relatively recently. And there is a quote from, I'm pretty sure it's Martin Luther King Jr., where he says, most men, and he meant everybody, most men are undergoing a spiritual death way further, way earlier than a physical one. And I think that's incredibly true still to this day, and probably even more so. So, as soon as you take somebody's belief in that they can get better, you dissolve the will. The will is a higher faculty. If you haven't heard of the higher faculties, they are our senses that exist in the conscious mind that interact with the non physical. There are several different models of this, but all of us know see, hear, smell, taste, touch. That's what anchors us to the physical reality, even though we live in a quantum one. There's also the higher faculties, your memory, your will, your intuition, your imagination, your perception. All of these things essentially create meaning and create lasting change in the essence that I can use them for life affirming things or non life affirming things. I can use my will to force myself to work out, to read, to create, to have hard conversations, or I can use my will to suppress my voice. I can use my memory to essentially remember back when I was successful at something, or I can use my imagination to imagine a future that is going to be much more abundant than the current one is, thinking from the end in mind. But I can also use my memory to remember about that time that I felt ashamed, embarrassed, insert some sort of lower vibration feeling. I can also use my imagination to worry about things. Fear, ignorance, doubt. It's what we talked about last week. It's all existing in the imagination. So these higher faculties, I think, are essences of the spirit, even though they exist in the mental plane as well. But when you steal away knowledge, when you steal away essentially the empowerment that almost needs to exist within the individual for them to take on agency so that they make the correct decisions for their life, then they're undergoing that spiritual death, which eventually leads to like this mental defeatist expression, and then this physical ease, lack of homeostasis. So the goal would be just how we talked about knowledge is the solve for ignorance last week. Knowledge is the thing that we're aiming to perpetuate as opposed to ignorance equaling disease and disintegration. How do we invite more knowledge into the treatment room, into our marketing, into our protocols? It's the acknowledgement that virtually every single disease, I don't want to say every single, but virtually all the ones that we've put names to stem from some sort of mitochondrial dysfunction. And if that's the case, then what are the things that are going wrong with the mitochondria and why are they showing up in the ways that they are? So let's look at what is current practices right now. Let's just say for chronic low back pain. Some element of corticosteroids. Corticosteroids, if you haven't read the literature, essentially they denature protein. They pull apart ligaments. They exponentially make you more likely to have stress fractures over time. They dry out joints. So when people are opting into this system, just the sheer expression of low back pain, you can draw this very clear line of demarcation where they were pre medical intervention to post medical intervention. And when they have that medical intervention of even a singular cortisone injection, I believe, and just because I've seen it a bunch of times, so this is completely conjecture, I don't have any science to back this up, but a single cortisone injection will set up the cascade for degenerative disc, compression fractures, drying out the muscle, muscle loss, and eventual early death. So if that is the case, and we want to take this seriously, not in the serious element of we're going to scare everybody, but in the serious element of this is a real occurrence. These are people that are talking to us every single day that they've had one, if not 10 of these things. And the mentality is you get it and you hope it lasts a while, but as soon as it starts wearing off, it'll come back. And then eventually they'll tee you up for surgery. And we know with surgical intervention, let's just talk about the spine for a minute. With surgical intervention, if I'm going to opt into a fusion or a disc replacement, I mean, really the only one that has a low risk profile is a laser discal material kind of resection. But if I opt into the more advanced surgical interventions, I'm looking at adjacent segment degeneration, accelerated adjacent segment degeneration, eventually muscle atrophy, specifically in the multifidus. So the multifidus will get fatty infiltrate. You can quantify this on MRIs. As I get fatty infiltrate in the multifidus, I'm going to degenerate the spine even more. I disrupt reflexes. I disrupt the brain-body communication as far as the sympathetic trunks coming out. And now I've changed the organ expression. As I've changed the organ expression, whether it's in the upper or lower spine, if it's in the lower spine, now I'm fermenting food instead of digesting food. If it's in the upper spine, it's going to change the way that there's electrical conductivity happening within my chest cavity. If it's going to happen up in the neck, I steal away blood supply from the front part of my brain. This is all researched and like backed by decades of surgical research. The Italians did a great study on atlas laterality and frontal lobe blood supply. Essentially, it stole the blood supply from the frontal lobe, making us less human and actually hyper stimulated the amygdala. So essentially making us more reactive. It made us more reptilian, having neck issues. We don't have the brain body balance to opt into rational abstract cognitive abilities, opting into life affirming higher faculties. I'm less likely to be able to use my memory and my will and my imagination for good just from my neck being bad. So, again, if we are focusing on symptoms, you're accelerating degeneration. You are literally helping someone die faster if we are practicing degenerative medicine. If I'm practicing regenerative medicine, it's going to require a complete reorganization in how we look at the person in front of me. They exist on three planes: the physical plane, the mental plane, the spiritual plane. And I'm not going to act like I know exactly what's up there. But what do we understand on the physical plane? What does every single thing that we do require? ATP, a thought, an emotional regulation, a heartbeat, a muscle contraction, every single thing that these bodies need. And I'm fairly certain every single movement of energy that happens on this planet requires ATP. And where does ATP come from? Fourth grade biology, the mitochondria, the powerhouse of the cell. We are as healthy as our mitochondria is. If you didn't know, our mitochondria don't even have human DNA. It's a bacteria. So this bacteria, and we have tons and tons and tons of them. I've heard different things. I've heard it can be 8% of our body weight. I've heard that that was a farce, but we have a lot of these things in each differentiating cell type in our body. As an example, I think our heart has on average, I think it's like 30,000 mitochondria per cell. Our brain is going to have somewhere in the realm of 10,000 per cell. We are an electrical being. We are built completely on electrical current and pressure gradients. And as soon as we start to mess with our conductivity, whether we're not giving it the proper components, or whether we are constantly starting fires, as in like chronic inflammation, whether we're exposed to too much of this stuff, all of that just disrupts the electrical nature that is our body. That's where chiropractors really got it right. They're saying, okay, your brain to body to brain connection is the only thing that matters. That's your electrical fuse box of your entire body. And I'm going to take it one step further because this is our philosophy anyway. Our core philosophy is mental, emotional, physical trauma damage the body. So why not we look at it in a mental? You can help someone on the mental plane, and we'll talk about that a little bit today. You can help someone on the chemical plane, and you can help someone on the physical plane. And let's just start it from that element of every single person that comes in my body, every single person that comes into my office, I'm looking to serve them on all three of those planes. Every single person. I'm not focused on anything else. I'm not focused on how much they're paying me. I'm not focusing on whether there's a game on tonight. I'm not focusing on my kid threw up on the floor, my dog threw up on the like. I'm in the room. How do I serve this person on three planes? If we're virtual, how do I serve this person on three planes? You still can do that. So number one, how do I serve them on the physical plane? Pretty straightforward. An adjustment, some sort of therapy, something where you are physically interacting with their body. You can make them get up and move. I can change my camera angle and I can make their brain focus a little bit more. Focus and novelty and movement make their brain focus. So I want to capture their attention. When I capture their attention, I'm either doing it with an adjustment, with a conversation, with linguistics, chemically change. How do I do that? Supplements, diet, peptides, stem cells, exosomes, EBU. There's all these ways that I can chemically change somebody, but I have to have a reason. And ideally, just like an adjustment, needs uh, right bone, right depth, right time. Chemical intervention, ideally, we have the right dose, the right combination, and then the right length of time. So the goal would be every single person that comes into this place, it's a dose response. So I'm physically affecting them, I'm chemically affecting them, and when I'm mentally affecting them, I'm teaching them about things where it's like, hey, you have these higher faculties, and let's make sure that the first thing is you got to believe that you can actually heal. And if you don't believe that you can get better, you can hinge your belief that I believe you can get better until you start to believe it as well. And it's the exact conversation that I have. I have that 20, 30, 40 times a day. I don't see as many patients now, but the goal would be every single time someone comes into my office, I'm touching on all three of those planes because each one is going to be moving them toward the x-axis toward health. That to me is going to be real regenerative medicine. It's acknowledging whole body. So as a recap, degenerative medicine is going to be plainly not acknowledging that all problems are downstream of mitochondrial function. And if I'm ignoring mitochondrial function, essentially I'm stealing away this person's hope because I'm giving them a medication that only treats downstream effects. You have someone that's walking into a medical doctor's office with fires in their body, and instead of dealing with all the fires that are actually going on, you are giving them an SSRI, or you are doing a corticosteroid shot, which we already talked about, accelerates disease and death. Now, what are the things that the body is going to respond to with a high affinity if I'm just looking at chemical inputs for healing mitochondria and ultimately healing the brain? Because anytime there's a problem with mitochondria, I'm going to change the brain and I'm changing the electrical nature of the body. So, number one, creatine monohydrate. Creatine monohydrate is going to be one of the best supplements that you can recommend. It's the most researched supplement you can recommend. It's been around for decades, like tons and tons and tons of research, where it's a very slow molecule to cross the blood-brain barrier. You're going to need a lot more than is typically recommended. You're going to need somewhere in the realm of like 15 to 25 grams per day as opposed to the 5 grams per day that most people are taking. And especially for women, because of the cognitive load and emotional regulation are one of the primary duties of the feminine, especially if they're in childbearing years and they have multiple children. We know that women are responsible for regulating the nervous system of their children up to the age about 7 or 9 until their unconscious mind gets sealed off from their conscious mind. So that kind of blunt on emotional regulation, that amount of ATP that is required is needs to be supplemented in some way. We got to make sure that their diet is in order, they're sleeping the proper amount, they're doing some element of recovery. But creatine monohydrate, we know that at 25 grams per day is going to blunt the effects of sleep deprivation on the brain. So, big one. Another one is going to be another one's going to be melatonin. So, what if I told you that melatonin has nothing to do with making you sleep? It is not a sleepy time hormone. Even though I can tell you that when I take melatonin orally, I feel weird and I fall asleep and have weird dreams. I think part of it is placebo, and I think part of it is when you ingest it orally, it acts different. And also, if we are looking to get the actual benefits of melatonin, which it actually is one of the most powerful antioxidants for the nervous system, but it gets to be done in the realm of like 100 to 300 milligrams a day. And it's primarily got to be done through suppository. I recommend this one to all of my concussion protocols. So when someone comes in and they have some sort of CTE or they have some sort of chronic inflammatory response happening in the brain, and we do have ways of quantifying that, whether they have PTSD, depression, anxiety, OCD, to me, that is brain on fire. And that is when cortisol is running rampant and you are starting to degenerate this process. I've talked about it before. I have this company that we contract with called I Express Genes, and we can quantify whether or not somebody has PTSD, is predisposed to PTSD, and what system it's actually attacking. Because it'll attack one of three systems, either your connective tissue, your nervous system, or your immune system. What is PTSD in this definition? It doesn't mean you have this massive trauma event. It could, but it could just be this slow drip of stress over time. You've effectively become allergic to your own stress. And if that's the case, that's when you're going to have brain on fire, gut on fire, spine on fire. And now we get to say, one, is that actually what's going on? Two, what system is it attacking? So we know how to supplement it and take care of the mitochondria accordingly. And then three, we actually have a way of measuring and testing how much better that they've gotten. And so this company, I Express Genes, they're great. Highly recommend them. I don't know if their test is going regular market yet. In the past, they've only been distributing to government contracts and to HCA for these larger studies. Newer company, they've been around about 2 years as they are. But that is one of the tests that I will run if they're having some sort of mental, as far as like mental expression. And I say, okay, let's run this test. It's an at-home test, very simple. They prick their arm, they send in this vial, they get the results back, and then we say, okay, this is the program we're going to do, whether it's brain, whether it's connective tissue, whether it's immune system. It's a great guiding principle. So melatonin, not a sleepy time hormone, and melatonin is so important that mitochondria makes its own melatonin locally. So it will make its own so it can sustain itself. It's a powerful, powerful, powerful antioxidant. I would be wary of giving this to children. Several times a year, I will have parents come in and they say, hey, my kid is 13, 14, 15, and they're not growing. I always ask them, hey, are they taking some sort of oral melatonin at night? And they say, oh, yeah, they have this nighttime thing. What that will do is it disrupts serotonin and disrupts growth hormone. So this must be done intentionally, cannot be done orally as well. It acts differently. And suppository, there's a lot of companies out there. Mitozen is probably the one that I would recommend. They're the ones that I've been following the longest, but there's a bunch of companies out there. I don't have any ties to them. The next one is going to be lion's mane. Lion's mane is going to help the brain itself actually start to grow new synaptic essentially makes the dendrites grow longer. They start to reach out and they can reach out over damaged areas. They can make new connections that they otherwise wouldn't have had because when there's mitochondrial issues or there's chronic inflammation or maybe there's head trauma, maybe there's some sort of bacterial infection that's affecting the brain, those start to shrink down and they limit the communication that they have. Anytime we are operating in isolation, that is going to be when disease proliferates, whether it's on the micro level, like within my brain, or on the macro level, as in like I am socially isolated. So, lion's mane, highly recommend it for brain function. It's just going to, as you start to reboot your mitochondria, that is going to be one of the things we want to perpetuate, especially if there's been atlas problems. The next one is going to be hyperbaric oxygen chamber. Hyperbaric, great. You want to make sure that you're getting at least 1.6 or above atmosphere. Anything below that is just going to be placebo effect. When you are talking about hyperbaric, essentially it's taking like an oxygen molecule that's about this big and it's shoving it down to be this big. And that's how you're getting this immense amount of tissue perfusion of oxygen. They did this study in the 1950s where they took several baby pigs and they put them inside of a hyperbaric oxygen chamber. They drained every single drop of blood out of these pigs. And because of the hyperbaric oxygen and the tissue perfusion of the oxygen, they were able to stay awake and play with each other for 3 days without a single drop of blood in their system. That's how profound hyperbaric oxygen can be. And when you have mitochondrial issues, whether it's within the brain or within the joints themselves, or someone has a mold infection and you're having this hypoxic response, this low oxygenated response, if you're able to force oxygen into there, then you're going to start to change that person's state and start to help it heal. The next one, so since we're talking about specialized, next one would be EBOO. So EBOO is an interesting one that helps the mitochondria immensely. And this is probably the therapy that, I mean, I've been playing Petri dish with my body for a long time. Probably since I was about 18 years old, I got into, I worked at some supplement shops. I worked as a personal trainer for a long time. I started training bodybuilders and athletes before I went to chiropractic school. And then I started working in a neuro lab in San Diego, and that's when I started getting into vibration as a proxy for the nervous system and how that can disorient or how it can actually get people that had prior strokes. When you strapped vibration to their joint angles, you're effectively able to help them start to track and mirror healthy gait. One of the things that I really like about EBOO therapy is one, you're depressurizing the chemical load on the body. You're running it through a dialysis style mechanism where you are able to pull out things and quantify it like glyphosate, metals, molds, spike protein, all within this jar. You can send it into Vibrant and they will test it. But then the next thing is you're oxygenating the blood. You're shoving not only ozone, but oxygen into the blood. And if you have the right machine, you can dial up the flow rate. You can dial up the ozone and oxygen amount. So ask me offline which machine you would like to is the better one, because we've been interviewing all these companies, and I think I've found one of the best ones. But oxygen into the system is going to help with tissue perfusion. Ozone is a heavy gas. It's O3 instead of O2. That O3 molecule essentially breaks off when it gets into the bloodstream and it acts like a missile. It travels around and it goes to areas of damage and starts to clean up, whether it's bacterial infections, viral, if there's local, so extracellular versus intracellular swelling within a joint, it goes inside there and starts to change around the pressure gradients. So that's how it can help with pain. But one of the things that I've noticed, this was probably the therapy that did the most for my cognitive function. I've tried a bunch of stuff. I've tried methylene blue, and it's not Adderall. I'm not going to tell you it's an Adderall feeling. I've tried methylene blue and nicotine patches and MOTS-C and SS31, BPC. I've tried all these things. This was the thing that I noticed the most amount of mental clarity almost immediately. I think you get a serotonin dump, so you do feel all lovey and it's kind of an empathogen. But when you are affecting the body and getting this immense amount of oxygen perfusion, you accelerate NAD and you're going to help with the ATP stores. So whether it's hyperbaric oxygen, whether it's EBOO, whether it is lion's mane, methylene blue, creatine monohydrate, even iodine is very important. All of these chemically will affect the mitochondria. And one of the last ones that this is one I've just recently started studying, iron. Iron, I believe now, is one of the things that is the most neglected and also the most critical in the mitochondrial process of making ATP. So much so that most, I would say most of us have an iron issue, whether it's iron binding capacity, whether it's in the hemoglobin, whether it's our ability to convert it like into the usable version of iron. And the thing is, most of us don't need to be supplementing iron because iron can cause constipation. And then there is this process called ferroptosis, where if I'm taking in the wrong type of iron or too much iron, then essentially my cells start to rust. So, iron, if that is something that you're going to be looking at, we want to test first. We want to get the right kind actually supplemented into you. And then we want to test again to make sure that our levels are getting into the right sweet spot. So, how I recommend it is I say, hey, patients, let's get you using liver pills. I like the brand Heart and Soil, but there's a bunch of them out there. And then, if we're not able to get it up, then iron bisglycinate is going to be the one that I would recommend that they use. It's going to be the one that's the least toxic, and it's going to be the one that gets us more controlled doses. So, iron and copper, huge players. And the reason I put those together is because that's the entire like molecule that you're handling within the mitochondria is it's two coppers, two irons, and it works very beautifully. I'm pretty sure it has to do with CMP5 during oxidative phosphorylation. So there's all these supplements that we can use. There's peptides that we can use. We talked about them last week, SS31, MOTS-C, BPC, even CJC and ipamorelin all contribute in some way to mitochondrial function. What else is going to contribute to mitochondrial function? Light, oxygen, light, and then the little stuff, the minerals, macros, and minerals. So most of us have an issue with at least one of these. Either they're in a low oxygenated state kind of all the time, they're not getting the proper amount of light, or they're under fluorescent lights all day, they're getting exposed to blue light at night and it's disrupting their sleep cascades, or they are taking in the wrong raw materials. The goal would be you acknowledge which one is likely affecting your patient the most, or you set up some sort of protocol where they are affecting all three of these. So I tell patients, and this is how I verbalize it, what is the lever that we want to pull that is going to help you the most right now? So I figure out what their goals are. Hey, if you can look and feel and be able to do everything you want in the next 6 months, what are those things? What are your priorities? And we make three. And I tell them, hey, if we have more than three priorities, you have none. So what are our three priorities? And then from there, we start to lay out the plan. Are we deficient in certain things? Do we have poor sleep patterns? Do we have a spine issue? Is there a lot of mental load and maybe some belief architecture that you get to help them walk through? I'm not saying be their therapist, but I am a big fan of penetrating questions and then saying, like, what do we want to do about that? Do you have a journaling practice? Do you do any prayer or meditation? Do you get out in nature and walk? Paul Chek will talk about, he was one of my first mentors when I was in San Diego. I went to the Chek Institute for a little while. He would talk about the four doctor model. And this is how I learned it. And this is how I tell it almost every day. I talk about it at least once a day. I say, have I ever taught you about the four doctor model? And they're like, I'm like, okay, well, these are the last four doctors you'll ever need, and they're all inside you. Dr. Happy, Dr. Diet, Dr. Movement, and Dr. Quiet. Let's just start at the top. Dr. Happy. What is fun? What gets you in this childlike curiosity expression? What is creative? What are the things that are happy making for you? I'll ask them that. Like, are you doing happy making things? I'm like, yeah, I love to journal and I do some art and I love getting outside and I love playing with my kids. I'm like, amazing. So, Doctor movement, pretty self-explanatory. What are your movement practices? And depending on what season you're in, will be what is calling forward with your movement practices. Is it, do I need to do more energy giving things because my cortisol is all shot? Or do I need to do rehab type movement? Am I training for a marathon? Am I losing weight? All of those are going to change the doctor movement consultation. Doctor diet, also seasonal. So eat for the season we're in. Am I losing weight? Am I balancing hormones? Am I gaining muscle? Am I in premenopausal or menopausal? All of those are going to tweak the diet just a little bit. And then the last one's Dr. Quiet. How often do you spend time in self-reflection away from all the expectations of everything else on top of you? And I'll say, okay, and I'll teach them all of that exactly how I just said it right now. And I say, which one do you think you need the most right now? And then they'll say, I don't know, Dr. Diet or Dr. Movement. And then I say, okay, great. What can we commit to starting today? Okay, I'm gonna start lifting weights. I'm gonna lift weights twice a week. Okay, great. How can I support you with that right now? What does support look like from me right now? This is a way of mentally serving somebody. I'm walking them through this process. I'm not telling them what to do. I'm gradually, if you've noticed what I'm doing, I'm gradually giving them permission to change their habits because most of us know what to do, but we haven't given ourselves permission to change because the brain will seek what's familiar versus what's good for it. And if I am slowly giving you this series of prompts that is walking you down this lane of you giving yourself permission and actually be inspired, like inspired action, inspired in the spirit of, I'm in the spirit of the future version of myself. And when I am disciplined, and what does discipline mean? Discipline means I'm putting the wants and needs of the future over the ones today. To use Jordan Peterson's language, I'm taking care of myself like I'm someone that I love. A lot of your patients, the only time they make for themselves may be in your office or maybe on your virtual visits. So the goal would be you're slowly giving them this open door to walk through to give themselves permission to take care of themselves like they matter, to believe in themselves, to believe that they're supported and divinely guided. So when I'm walking them through this process, and I think that's what makes it a little unique, it's like, yes, I'm adjusting them. And yes, I'm giving them advice, but I'm also walking them through this process where it becomes their idea. If it's their idea, they're more likely to act. And if it's their idea and they're seeing that someone is just holding space and then watching, they're more likely to stick to it. I was noticing it yesterday. I had one, two, three, I had four men come in my office yesterday, all for different reasons, like different immediate reasons, but they've been with me for a long time as far as care. One of them just wellness, another one for like a functional med consultation. One of them was acute low back, and I forgot what the other one was. All of them have lost over 40 pounds each in the last like 18 months. Phenomenal, unbelievable. Some with GLPs, some natural, but people now more than ever are becoming the informed patient. They're looking things up. They want answers. They want guidance. They want to be walked down this process where they can actually quantify, am I better today than I was 365 days ago? I had a woman yesterday. She was like, hey, I don't feel like I'm doing the right things. To when we do my DEXA scan, maybe at the end of the year or the beginning of next year, I'm not going to have more muscle mass than I did last year. So that means I need to change things. So if that is the case and the age of the informed patient is here, that means the age of the actual three-tiered doctor is here. How do I serve them physically, chemically, mentally? So the goal would be every single time they come in, I'm going to be teaching them something. I'm gradually walking them down this aisle of permission. It's the illusion that there's all these doors that they get to choose, but there's really only a few doors that we get to choose if we want to be healthy and live long and live well. It's kind of like what's the saying? If you want to go play football in college, there's a lot of routes you can take. There's a lot of coaches that can teach you. There's a ton of people that have played college sports. If you want to play professional, if you want to be a professional golfer or a professional footballer, then I need to go find someone that trains those people. And if you want to be the doctor that's leading them to health and especially if they've been in dishealth for a long time, whether mentally, chemically, or physically, then you get to do different. And you get to walk them through these doors that nobody else is walking them through. Everybody else is still opting into degenerative medicine. They're still all opting into ignoring what's upstream because all the medical schools are sponsored by AstraZeneca and Pfizer. Instead of just learning chemistry, let's learn chemistry. What are the things that are life affirming? Let me study what healthy people do as opposed to studying illness. What's the phrase? It's like you're not going to learn the Palmer quote. You're not going to learn the elements of floating things by studying thinking things. I need to study what actually is health as opposed to studying what disease is. And the intention would be not to fight the system, but just to create a whole new system. It's the whole Bucky Fuller quote. Just invent a new system that the old system is irrelevant. And I think that's what we're all doing right now. Regenerative medicine was not a name. Functional medicine, even as of like as recent as when I was in school, I went to a functional medicine essentially class over the weekend. I come back on Monday and we were talking about it. And one of the professors was like, functional medicine, that's not a real thing. You just put two words together, it means nothing. That was like in 2012. So if that is still taught, I mean, not even that long ago, we're on such the cutting edge of things. And all we're doing is just studying what's life affirming and meeting the person as an entire person, as opposed to treating a disease process, looking at effects, and refusing to look upstream. And unfortunately, still a lot of chiropractors are doing that. A lot of medical doctors are doing that. A lot of clinic owners are still doing that because they're just trying to sell something. They're just trying to do what was taught to them. And to no fault of their own, that's just how they were taught. So if you are looking at someone and acknowledging that they live on three planes, acknowledging that most problems are downstream of a mitochondrial issue, and if I can directly affect them on all three of those planes and invite them on this process of permission, then they're going to get better. And I made a protocol for you guys. I'll drop it in the chat and we'll send it in the video of everything that I spoke on today. Doses of creatine monohydrate, iron, iodine, nicotine's on here, melatonin, hyperbaric, lion's mane, the peptides I mentioned. I built this protocol. I'm starting to build all the protocols that I've been talking about last decade for long COVID, for brain body balance, for thyroid issues, for gut issues. So I'm just building these and they're broken up between foundational to structural, actual structural reintegration, and then specialized. Like if you want to go really advanced and you're doing things like EBU, hyperbaric, stem cells, exosomes, they all have a place, but it's a matter of when and after what. I think that's all I have for you today, guys.